Prinzmetal angina. What is Prinzmetal angina? Prinzmetal angina is a rare and severe form of angina pectoris. I'm going to get into details and explain to you what exactly angina pectoris is. But Prinzmetal angina was named after an American doctor called Myron Prinzmetal, who published a work on the condition in 1959. Now, an interesting fact about Prinzmetal angina is that it is actually more common in younger women. You understand? It's more common with younger women, and it also accounts for like 2 to 10% of the all angina cases. You understand? Some triggers for Prinzmetal angina, for an episode rather of Prinzmetal angina. They can be in different classes. We have the physical triggers, we have dietary triggers, and we have environmental triggers. So the examples of the physical triggers, we have cold temperature. Exposing yourself to cold could trigger an episode, and that would be nice. So you really have to cover up like majority of the time. And also exertion, physical exertion, that's like working too hard and all of that. And also emotional stress could also trigger an episode of angina, of this type of angina rather. Now, some dietary triggers are intake of alcohol, intake of excessive caffeine, intake of heavy and spicy meals could also trigger it, and also intake of foods that are high in tyramine. That's like an example is cheese or wine. You understand? Environmental triggers include high altitude, exposure to pollutants, exposure to chemicals. You understand, like lead, pesticides and all of that. Exposing yourself to them could trigger an episode. It is also known as variant angina or angina inversa, and it is characterized by series or episodes of chest pain, severe chest pain, like really, really severe. Now, like I previously said, Prinzmetal angina is a form or like a type of angina pectoris. Now, what is angina pectoris? The word angina is a Latin word meaning pain, and pectoris is also a Latin word meaning chest. So putting that together, we have pain of the chest. So angina is generally used to describe any pain that originates from the heart. Now, this pain is usually as a result of ischemia of the myocardium. Ischemia meaning low blood supply or no blood supply at all, literally. And the myocardium is referring to the musculature of the heart. Ischemia of the myocardium is as a result of the narrowing or obstruction of the coronary artery that is supplying that particular region of the myocardium. And when this narrowing or obstruction takes place, it leads to less blood supply, and also less blood supply also leads to less oxygen supply. This reduced oxygen supply to the myocardium now forces the myocardium to go into anaerobic form of metabolism, which also leads now to the accumulation of lactic acid in the muscle fibers. Now, this accumulation of lactic acid stimulates pain receptors in the muscle, and this pain now is reflected or referred to the chest region, leading to angina pectoris. Also, low blood supply to that particular region of the heart leads to myocardial infarction. What do I mean by myocardial infarction? Myocardial infarction just simply means the tissue death, because now it's not getting any blood, it's not getting any nutrients. So that particular part that is lacking in blood, in oxygen, and every other basic and necessary nutrient is going to begin to die. So that's what we call myocardial infarction. So the death and the necrosis of that particular tissue also adds to the pain that this person is going to be feeling in their chest. So what exactly is the difference between typical angina pectoris and Prinzmetal angina that we are discussing today? Now, the difference now is that typical angina pectoris is usually caused by a blockage of the coronary arteries, maybe blockage by a clot, blockage by in conditions such as atherosclerosis. But in Prinzmetal angina, it is quite different. It's not because of any sort of blockage by a particular thing, but rather it is due to narrowing or spasms, like sudden spasms of the coronary artery. Another fact about Prinzmetal angina is the fact that the episodes of this chest pain are usually unpredictable and have no pattern at all. But in angina pectoris, there's usually a pattern, and you can usually predict when next you will have an episode. Another thing is that the episodes last longer in Prinzmetal angina. They last for about 5 to 60 minutes. That's like over an hour. You could be suffering from severe strangling chest pain. But in angina pectoris, it just lasts for a minimum of 5 and a maximum of 15 minutes. Another thing is that usually for typical angina pectoris, rest could just be the simple solution to it. But in the case of Prinzmetal angina, rest even makes it more severe, makes the pain more severe. So that's why I initially said that Prinzmetal angina is actually like a more severe form of angina pectoris. Now, some symptoms of Prinzmetal angina include, obviously, the first one is chest pain, serious strangling type of chest pain that lasts for a very, very long time. It is usually accompanied with nausea and syncope, which is just medical language for fainting. Like, the pain could also radiate to the arms, the shoulders, the jaw, and the neck. Like, it could radiate not just in your chest, you could also feel pain in these other areas. Other symptoms are shortness of breath, lightheaded. Some complications that could arise from having this condition called Prinzmetal angina include myocardial infarction, sudden death, sudden cardiac death, and also it could also lead to heart failure eventually, you understand, because these spasms or these constrictions of the blood vessels last for over an hour. So if these episodes are continuously recurring, it could just all of a sudden, heart failure, heart attack, and cardiac death, and eventually over the years it could just lead to death of the person. Now, treatment approach for Prinzmetal angina. Now, the treatment usually focuses on reducing these spasms, you understand, reducing these constrictions that are happening in the blood vessels. Treatment usually involves the use of calcium channel blockers, you understand, which block the entry of calcium ions into the smooth muscle cells, thereby relaxing the walls of the arteries and also reducing the spasms that occur in the artery. So that is one way to alleviate it. Also, the use of nitrates also helps in that same fashion, as relaxing the muscles, relaxing the wall of the blood vessels, and also reducing the spasms that happen. Also, use of antiplatelet agents such as aspirin help to reduce the formation of blood clots during an episode. Another medication that could be used is beta blockers, but they are selectively used because they don't really work on the arteries themselves, or they don't work in reducing the spasms or relaxing the walls of the arteries. Rather, what they do is that they reduce the use of beta blockers now reduces heart rate and reduces heart contractility. So all it does is just to reduce the workload of the heart, you understand, so that the demand also for blood and the demand for oxygen would also be reduced. So these are just a few ways that Prinzmetal angina can be treated. So that's all for today. Thank you for watching. Please like, share, and hit the subscribe button.